All right, family visits, meals to cook, gifts to buy, all the food you eat. It can be an exciting but also overwhelming time of year. And if you're not careful, holiday celebrations can become really stressful. Cardiologist Denise Dietz from Secours here to offer some helpful advice. First, thank you for your time. I know you're busy.
Yeah, happy to be here.
And this is an important topic. You know, why is there so much stress? What is the impact of stress that we don't think about this time of year?
Yeah, I think there are two ways to think about it with the holidays. One is there's this idea of a holiday heart syndrome where we kind of liberalize our diet and what we do and drink and eat. So if people consume too much alcohol or too much salt, then they can develop holiday heart syndrome, which is typically atrial fibrillation, an arrhythmia that can have a stroke risk and heart failure risk associated with it. So that compounded with just the reality of all the stressors of the holiday.
Buying gifts,
traveling, dealing with relatives, finances, all that kind of stuff can kind of exacerbate any underlying heart conditions. So we want to be mindful if you have any underlying heart conditions that stress can make things worse.
And it's okay to let your family know too that that you're dealing with this. But what are some signs or symptoms that someone may be experiencing something serious and they need to get help?
Yeah, with regard to atrial fibrillation, the holiday heart syndrome per se, if you feel decreased energy, short of breath, chest pain, lightheaded, dizzy, pass out, those are some red flag symptoms of atrial fibrillation. Certainly a good reason to go get checked out. And then for those of our patients who have underlying heart disease like heart failure, coronary disease, chest pain, shortness of breath, increased swelling in their belly or their legs, weight gain that's not otherwise explained by dietary indiscretions can be red flag symptoms as well.
Okay, so when should someone make an appointment with a doctor and when should someone rush to the emergency room?
Good question. We get a lot of those calls on call at night. I'm a big gut feeling person. Trust your gut. So if you're having new or worsening symptoms, trust your gut and go get checked out. Secours actually has a wonderful set of urgent care centers, and they can triage you and kind of help decide if it's a big problem or a little problem. But typically I tell patients that getting a set of vitals and getting checked out is probably the best course.
Is there anything that you can do to kind of mitigate the stress yourselves this time of year? Some steps that we can all take to just make sure we don't get overwhelmed?
We need all need those reminders at some point. So yeah, limit or be mindful of your alcohol intake, salt intake, get regular exercise, include that in your holiday routine, get good sleep, stay well hydrated. And like I tell my patients is kind of avoid the conflict, just kind of, move on or, move to a different topic.
If you know you have a relative who gets under your skin, maybe put a little distance, right?
Yes. Pick somebody else to talk to, especially in the airport lines and traveling. Just maybe not engage and just focus on your family and all the good things that the holiday brings.
And that's is there breathing techniques too and things you can do to calm yourself down?
Yeah, well, yoga and deep breathing techniques, there are apps for this now. Even your Apple Watch can alert you or help you do these deep breathing techniques. Yoga, any sort of exercise is stress relieving, just as a few suggestions.
What do people do? Like, are there resources out there? Maybe Secours has some that can, if you feel like you're a person who tends to get really stressed really easily, and you can identify that in yourself.
Yeah, stress mitigation is a big part of our practice. Unfortunately, it's dependent on some sort of stress reduction, and your lifestyle is very important. So that means finding time to exercise, being mindful of your diet, making time to go to your routine doctor's appointments. All these simple things help your health outcomes.
Let's go over one more time because I think this is important. Some of the key symptoms where you might need to call someone for help or go to a doctor.
Yeah. Shortness of breath, decreased exercise tolerance, chest pain.
Chest pain's a big one.
Big one, yes. Palpitations, rapid heart rate, lightheadedness, dizziness, passing out, swelling. All of those are kind of myriad of important heart symptoms.
Swelling where? Like ankles or?
Typically, with regard to heart failure swelling, typically it's in our lower extremities because it's dependent. But a lot of times men, sometimes women can accumulate fluid in their bellies. So their bellies can get larger, increased abdominal girth. So it's reflected by your weight. So if your weight goes up 3-5 8 pounds in a day or two, that's a red flag.
All right. Thank you so much for your time. Cardiologist Denise Dietz with Secours. We appreciate your time.
Thank you.